No avoiding. But what I do want to get you in. I guarantee you stem cells will help that.
Right.
I've had tremendous success with stem cells.
Right. In shoulder joint?
Yeah. I was told by a doctor that I was going to have shoulder surgery. He said, well, he did all of these exercises. We pushed down on it, and we did an MRI. He's like, it's so torn. He goes, you could try to rehabilitate. No, it was a little bit of labrum, but it was I had a full-length rotator cuff tear.
Okay.
And he's like, it's going to have to be repaired.
Right.
So let's try stem cells, and he was doing them for the UFC. And, they could do some pretty potent stuff. This is before some of the new regulations have come into place. That they're constantly trying to regulate this stuff because it's very effective. Well, I went in. He shot me up. I took it easy on it. I did the rehab. I started doing all these I used these crossover symmetry bands, and I started doing all these exercises to build my shoulders back up. And then I started feeling pretty good, and I started working out again and just being real careful. As soon as I feel pain, I'm going to stop. I went back to him in 6 months and got an MRI.
Right.
He said it was the most extraordinary thing he's ever seen. He said the tear is gone.
Right.
He said, I've never seen this before. He goes, I've never seen this. All my years of being an orthopedic surgeon, I've never seen a tear.
Right.
There's a new study that came out that's showing that they're able to regenerate cartilage tissue. And this is very, very promising. So when they're able to do this kind of stuff now, if you could just hang in there, here you go, Jamie. If you could just hang in there for just a year or so, I guarantee you they're going to be implementing this stuff on people.
See, I've got no cartilage in my big toes, no cartilage left, because all the sports I used to do are lateral movement sports. But also, sometimes shit goes wrong in a stunt, and you got to stop or you die.
Right.
So
this is it. Insulin-like growth factor 1 in articular cartilage repair for osteoarthritis treatment.
Right.
So they're able to do this signaling pathway that's been implicated in articular cartilage repair. IGF-1 is a member of the family of growth factors, structurally closely related to pro-insulin and can promote, I don't know what that word is, chondrocyte proliferation, enhance matrix production, and inhibit catabolism. Moreover, we discussed the potential role of IGF-1 in OA treatment. Of note, we summarized the recent progress on IGF delivery systems. Optimization of IGF delivery systems can facilitate treatment application in cartilage repair and improve OA treatment efficacy. Yeah. So there's this, and there's another one that's in Australia where they're using it on sheep right now, and they're able to regrow cartilage on sheep, and they're about to begin human trials on that as well. Here, healing discovery in animal models could soon lead to new human therapies. So this is the next stage, right? Because right now there's nothing they can do about cartilage. What stem cells have been really effective at is soft tissue injuries, tendon repair, things along those lines, and a lot of neurological disorders that people have, especially IV versions. They've done a lot with Dr. Neil Riordan in Panama. Has had some great results with that. And great results. Mel Gibson came in and talked about his experiences with that, and his father. His father was in a wheelchair when he was 80. 10 years later, at 90, was walking around. Right. And this is after stem cell. Okay. It's just, they can do some pretty extraordinary stuff, especially in growing disc tissue on people that have disc degeneration issues. It's just we're real close. We're real close to being able to regenerate all kinds of stuff. Right. So just got to kind of hang in there. Yeah. Hang in there. But I guarantee you what the stem cells can do is help heal what can heal in that area, reduce inflammation, give you more range of motion, and give you a much more pain-free experience.